Delaware budget writers are advancing a new state spending plan that funds raises, schools, healthcare, and retiree benefits, but also raises a bigger question for taxpayers. How much permanent spending can Delaware afford if today's strong revenue picture changes? The fiscal year 2027 proposal would provide nearly $147 million for state employee pay increases, including 3% raises for merit employees and education workers. Teachers, nurses, and classroom staff would receive additional increases tied to the state's effort to make public school salaries more competitive. The plan also adds major funding for healthcare, including $128.5 million for Medicaid service needs and more than $34 million for health services in the Department of Correction. Schools would receive continued support, with more than $2.5 billion for pre-K through 12th grade education. The budget also includes early literacy funding, school operations money, and $100 million in one-time funding as Delaware moves toward possible changes in the school funding formula. Supporters say the budget reflects Delaware's values and protects key services. Joint Finance Committee leaders also point to savings, including the elimination of 37 long vacant state positions, contract reductions, and fully funded reserves. But the long-term concern is that raises, Medicaid growth, childcare support, and education funding do not disappear after 1 year. They become part of the state's ongoing cost structure. That means future lawmakers could face tougher choices if revenue slows, federal funding changes, or healthcare costs continue to climb. The budget is not reckless. It protects reserves and funds real obligations. But it does continue Delaware's spending growth and places more pressure on future revenues to keep up. Thank you for watching Delaware Live News.